Hello everyone, back with another video with another interesting topic. So today let us discuss on the disease known as albinism. We are all familiar with the name albinism, albinos. So today let us understand albinism in detail. So albinism, it is the most common cause for albinism is the interruption of in the functioning of an enzyme known as tyrosinase. So tyrosinase is the enzyme that which interrupts in the synthesis of melanin. So albinism is an inherited disease characterized by a substantially lower rate of melanin production. People with albinism often have lighter colored skin and hair. Vision problems are very common in albinos. Melanin normally protects the skin from the UV damage. This is the melanin which protects the skin from UV damage. So melanin is the normally melanin, it protects our skin from UV damage. So people with albinism are more sensitive to sun exposure. So their skin is very light. So they are more prone to skin diseases such as skin cancer. So there is an increased risk of skin cancer in albinism disease. Most commonly, the mutations interfere with the enzyme known as tyrosinase. So tyrosinase is the enzyme which is involved in this albinism disease. The modification of that tyrosinase which is required for the synthesis, this tyrosinase enzyme is required for the synthesis of melanin. Melanin is the pigment which is present in our skin which gives dark color to our skin. So due to the impairment of this melanin synthesis, the people with albinism are very light colored skin they are having. So, which is this tyrosinase which is required for the synthesis of melanin from an amino acid known as tyrosine. So, what this tyrosinase enzyme, what does that do? Tyrosinase enzyme is required for the synthesis of melanin pigment in the skin from an amino acid known as tyrosine. So, tyrosinase is the enzyme which is required for the production of melanin from an amino acid known as tyrosine. So this is the thing. Depending on the mutation, melanin production can either be slowed or it may be completely stopped. Okay. And coming to the inheritance, how this happens. With autosomal recessive inheritance, an individual must receive a faulty copies of the gene from the mother and the father to develop this albinism. The parents who carry the genes often does not show symptoms. Only the offsprings are affected. So let us see the diagnosis. Physical examination, discussion about skin and hair pigmentation changes, examination of the eye by an expert, that is ophthalmologist, and comparing the individual's coloration with that of the other family members. So coming to the treatment, what is the treatment for albinism? Because the disease is genetic, there is no cure. So treatment focuses on minimizing the symptoms and watching for changes. That's it. Getting the right care for eye problems is very much essential. So let me show few of the diagrams of the albinism person, rattlesnake and wallaby. This is the albinism, albinos. You can see the person here, albino, and this is the rattlesnake and this is the wallaby. It is carrying the normal offspring. Only this is affected. Okay. I hope this video is useful for most of you. I will be back with more educational videos like this. Okay then, till then, take care and bye-bye.